100 man-years of work, approximately 6 to 7 crores of expenses, and 15 years of mine was decided on that day, on that one single vote. It was decided not to introduce this drug. I thought at that time there was a very thin dividing line between a great success and a great failure. Regret to say that I was side of the great failure. But I never regretted it. I thought we just cannot submit humanity to slightest doubt or slightest chance of getting them carcinogenic and so on. Till date, from that time, which was in the mid-80s, not a single case of all those who were treated, 4,000 and more people, have got cancer. It has been followed by them internationally, by the parent company. But then our decision was there that it does produce, in experimental animals, cancer. And therefore it's not acceptable. After that, I was put new projects for our company, venture management. And venture management, I must say, I traveled quite a bit, and because our company had become an Indian company in 1983, and I had to find new projects which do not originate from the parent company. And in that, I almost wrote 20 projects. Unfortunately, not a single one was taken at that point of time, because at that time, you see, the main aim of the organization was to import products, add value, and then sell it in India. It was a very tall order with our customs duty and many other add-ons to a product. It was very difficult that we could make a reasonable profit. So I gave up, and then I thought, because of this, now 25 years have gone, and there was little chance of putting up this project. But I must admit, after that, I took early retirement. After that, 5 or 6 of those projects have actually become reality. They have been taken. The progress was slow, but nevertheless sure. And but then my time was gone, and then I got an offer, very attractive, in which I was to look after a company, a small company, pharma company in Baroda called MJ Pharma, where I learned a lot of things. Even I learned Russian, a little bit of Russian, because our business was with Russians. And we exported hundreds of crores worth of medicines from India. I traveled far and wide in Eastern Bloc countries and made our things. I even went to sell our heart valve, discovered by Dr. Barua. You know, it's a zirconium heart valve. I saw it being planted among Russians, because there were no Indian surgeons prepared to plant it in an Indian heart, but Russians took it, and they are still working. And therefore, it was quite a varied experience. And I had moved away from a small group of people, research people, to a larger group of people who and learned the management. One of the things I learned at that time was that knowledge acquired any time in life is never wasted. Because during the course of time, when I was in SIBA, I did operations management at Bajaj. What does a scientist need operations management for? I'll tell you, it's a real life example. 1975, I had a heart attack, and I was recuperating, and I urged the company to give me a chance to do something for the company while sitting at home. Well, to cut a long story short, we provided a blueprint for movement of medicines or various products of the company, various parts of India, thereby saving 5 lakhs of rupees every month. This was an application of management learnt from my college while working. Anyway, after that, I felt that one of the things that happened, those who know about pharma industry will know and vouch for it, that there were two camps, the multinational camp and the Indian camp. I tried to bridge it because although I worked in a multinational company and later on in an Indian company, I was one of the members of OPPI and tried to bring among the chief executives of this organization to understand they are an Indian organization and they should not make any difference between whether they of Indian origin or foreign origin or any origin at all. And I think OPPI was one of the experiences for me which I will always remember. And at the same time, during all these years, I was always active in the scientific spirit and temper of our countrymen and pharmaceutical industry. We belong to a research organization. We started the scientific congress called Indian Pharmaceutical Congress, for which I worked for about 20 years. And it became a very big organization from what we started. Anyway, I was quite satisfied that one of the aims of my life at that time, and still remains unfulfilled, is that there is no database for pharmacists or for all that matter any professional in India. A database is absolutely necessary where you know where your professionals are. And this job still remains to be done. But this was one of my objectives which I wanted to do, but I never fulfilled. I told the organization, but it requires an organization and lot of effort. But if we could do, then we can do much better planning. Anyway, after doing this work in MJ Pharma, I was already closing about 58, and I thought I should start doing something else. I always had a streak in my life. I always felt that money should be, whatever saving you make, it should be better utilized. And better utilized, I thought, what best is that put to its use, in which also it spurs in small way industrial activity. And therefore I started investing in stocks. That was the underlying reason for it.